Our next presenter is Dr. Nadin Galal. Dr. Nadin is an assistant lecturer of pathology at Faculty of Medicine at Alexandria University. And her presentation is entitled, Sometimes You Need to Grab It by the Tail. It is under the supervision of Professor Dr. Basma Al-Sab'a, Professor of Pathology, Faculty of Medicine at Alexandria University. Dr. Nadin, you are with us?
Yes, doctor.
Okay, I can hear you now. If you can start sharing. Okay. I can see your screen. Now it's full screen. It's all yours.
Good afternoon. I'm Nadin Galal, Assistant Lecturer of Pathology at Alexandria Faculty of Medicine, and today I'll present a case entitled, Sometimes You Need to Grab It by the Tail. First, I would like to thank Professor Dr. Basma Sab for such a great opportunity. Our case today is a 77-year-old female complaining of abdominal pain. Ultrasound revealed the presence of ascites and an omental cake. An ultrasound-guided biopsy from the omental mass was done. Microscopic examination revealed the presence of an infiltrative neoplastic growth in the form of sheets of large plumpy cells with abundant glassy cytoplasm. These cells couldn't but remind us of rhabdomyoblasts. Therefore, immunohistochemistry for Desmond was done, and its strong positivity confirmed the rhabdomyoblastic differentiation of these cells. Together, side by side to these cells, tubulopapillary and acinar structures were detected. They were lined by cuboidal cells with increased NC ratio and hyperchromatic nuclei. Immunohistochemistry for PAX8 and WT1 was done, and their co-positivity confirmed the Mullerian origin of these omental deposits. CD10 positivity detected an endometrial type stromal component. So when you put everything together, these were heterologous elements in the form of rhabdomyoblastic differentiation in a Mullerian carcinoma. This case was signed out as an omental deposit from a Mullerian carcinosarcoma. Despite a radiology with no whatsoever mention of an adnexal lesion or a uterine mass, a uterine versus ovarian origin was recommended for radiologic correlation. Carcinosarcoma is a malignant tumor composed of mesenchymal and epithelial components. This rare tumor locates in various organs, including the GI, liver, breast, especially the uterus, and the female reproductive system. The histogenesis of carcinosarcoma is not well understood. Three main hypotheses have been proposed: the collision, combination, and the conversion theory. The collision theory suggests that the epithelial cells and the mesenchymal cells have to occur and fuse at the common border and give the impression of a single mixed tumor. While the combination theory suggests that both epithelial and mesenchymal components are derived from a common stem cell to form a single tumor. And finally, the convergent theory, which is the most accepted one, states that epithelial cells transformed into malignant cells that give rise to a carcinoma, while cells in the carcinoma undergo further metaplastic transformation to give rise to a sarcoma. Surgical staging is diagnostic and both diagnostic and therapeutic. Omentectomy is not a part of the routine staging, but the biopsy is often done because omental disease is known to be a poor prognostic indicator, which leads to upstaging of the disease. Take-home messages. Histology is always the key to diagnosis. And finally, multidisciplinary approach is mandatory to solve problematic cases. Thank you so much.